The vision of the LOC was to create a setup and an environment which provided people with the best possible standard of cancer care, but also focused on the whole patient, made them feel like an individual person when they came here.
What makes LOC special is the fact that we tend to build a relationship with our patients and also families.
You really get to know these people on a personal level. Beyond their diagnosis, they also have their own lives. They're working, they have families, they're a mother or father, and it's being able to tailor that healthcare to that person to fit their needs. It's understanding that this patient is getting married in 3 weeks. So how do we move around treatments or appointments so that they can attend that? It's understanding that their daughter has a graduation ceremony and being able to move things around so that they can still do that and achieve that.
The professionalism, the kindness, the compassion that we see every day is a true example for all of us.
I think the exciting thing that's happening in LOC at the moment is our network. So we're expanding the sites that we deliver treatment, the people that we work with. Patient access to us has improved throughout the country. It used to be very London-based when it was first started. We then moved to other sites within London. We're now moving to other sites outside of London. So developing a network of sites is very exciting.
A joint venture was set up between the Christie NHS Foundation Trust in Manchester and HCA UK to bring together the two organisations and create the Christie Private Care. So the LOC sits within the Christie Private Care in Manchester to provide the same level of good governance, patient-centred care, all the support services that were available in London. Bringing all of that together allowed us to offer the same level of care in Manchester as well. More recently, LOC has expanded to Birmingham, and I think that is important because moving outside of London gives more people access to the same level of expertise and care as was available only in London before.
At LOC, we have a very robust multidisciplinary team covering the whole range of oncology as well as hematology. Oncologists, hematologists, specialist nurses, supportive care workers work all together in order to deliver the best care in our patients, starting from intensive approaches up to innovation, supportive care and holistic approaches. In our MDT, we make sure that we make the right decision for each individual. At the same time, we can tailor the treatment, adapt it to the needs of the individual.
It's been an amazing time to be involved in cancer treatment, and actually the last 20 years has basically been the 20 years of my consultant career. There have been huge changes. The first would be targeted treatments, either antibodies or small molecules, really game-changing. And then 10 years ago, the field exploded with a whole new type of treatment for cancer called immunotherapy, where you're actually not targeting the cancer itself, you're trying to harness the power of the body's own immune system. So it's been a very exciting time to be at LOC and to be involved with cancer treatments. We're just at the beginning of the next revolution in cancer treatment, which is really ramping up the personalisation of treatment. We're getting away from these really heavy toxic chemotherapy treatments bit by bit and moving into this world of personalised targeted therapies, and the outcomes have been so amazing, and people's quality of life and longevity is a testament to that.
I have to say that I do have a sense of satisfaction that we have created an institute which, if I had someone in my family who was ill, if I was ill, I couldn't think of a better place to send someone with cancer.
I'm very proud to work in LOC because I have the chance to deliver the very best care to my patients.
For me, LOC means excellence, the ability to look after patients absolutely as you'd want to be looked after yourself.
It makes me feel really proud to be able to work where I am and to be able to say that this is the type of care I deliver.
Right from the beginning, we had the patients at the heart of our service, and I have to say that is something which hasn't just been maintained, it has been enhanced.
This combination of the human factor and also the clinical excellence that make everything so special and unique.
The initial philosophy has been maintained throughout, and we are very grateful for that.